procedures that you're going to have to code for at the same time. The procedure for the actual surgery on the segments and the spaces. If you're performing a discectomy, you're going to have to code that. If you're doing a vertebroplasty, you're going to have to code that. If you need to have a graft to help stabilize the surgery site, you may have to code for bone grafts. And to further stabilize it, you will have to code for instrumentation. And that process is called arthrodesis. You'll have to code for that as well. And if nerve surgery is involved, if nerves are involved, you're going to have to code for that and more. So these procedures can be very, very long, but you know what, coders? We love long procedure codes. We love long series of codes because the longer it is, the wronger it is. And another thing, whenever you're coding multiple procedures within the spine, all of these procedures should be coded using a modifier 51. Okay, modifier 51 because they are in the same area. Keyword, same. Okay, I have a little scenario for you to help you understand how to code for the spine. When I said scenario, did you think I meant coding scenario? No, not yet, not yet. We have to kind of learn a few more things and then we'll get to that. But this is my little story that I'd like to tell you. All right, John, my friend John was in an automobile accident. And ever since the accident, he's been enduring some pain going down his right arm. So he goes to the doctor. The doctor performs what kind of scan? Let's say, did an MRI. And the results indicated that John had some injury. In fact, if you look at the scan, let's pretend this is a scan. You look at the scan right here between C5 and C6, you'll see that the disc looks inflamed. In fact, it's bulging. Now, how do we know it's inflamed? Look at the other disc. Look at C4, C3, C3, C2. Look, they're nice and pale, kind of pale pink, but between C5 and C6, it's a little inflamed. Now I'm going to take my eraser and erase it so you can see how it actually herniates, meaning it's bulging out and touching the spinal cord. And anytime you have anything touch that spinal cord, that's painful. All right, so let's go ahead and review the anatomy of John's spinal cord injury. All right, the yellow portion, that's the spinal cord. Now, C3 is an example of a vertebrae or segment. And see that little pointy piece? That's the spinous process that we've spoken about. And again, there's disc herniation at C5, C6 level. Poor John. John's going to need surgery. Okay, so today is the day for John's surgery. He is going to have a discectomy. All right, when we code these procedures, we code them almost like the way I'm telling this story. We code it according to the approach, and this approach, in this case, John's approach, that means the way the surgeon's going to approach the surgery is from the front. So it's an anterior approach. Also, John is lying in supine position. He's face up. So that is an anterior approach. Next, after they make the incision, they reach their destination and they're able to observe the disc between C5, C6, and they begin to perform the discectomy. And as you can see, the skin is pulled back by the use of retractors, okay? And then the physician takes a tool and begins to remove the disc material. And after he gets as far as he can, we use another instrument to further clean it out. It's more like a drill or a burr. Okay, so they're doing the procedure that's called a discectomy. The next procedure is the harvesting of the bone graft. Bone grafts are often taken from the patient's own iliac crest. That's this area here. Okay, I don't even think you can see that. Let's try. Okay, so there you go. At this hardened, bony part, it, it it's a lot of it. So it's a great place to harvest. Also, they harvest from ribs, the fibula, and my mom just had surgery on her spine about 4 months ago, and they were able to harvest from her spine, from her own spine. She had previous spine surgery, and she grew so much extra bone that they were able to harvest from her spine area. Okay, and these grafts, these bone grafts, are also referred to as implants. Okay. They take it and they put it in a bone grinder. They mix it with the patient's blood and they grind it up, grind it up. And again, this graft is also referred to as an implant. Yes, of course it's an implant. See? I mean, this implant is actually replacing the old disc. And they take the bone graft and pack it right in there where the disc once was. Now, this process is called arthrodesis or fusion. Okay? So that means they're going to make that structure nice and sound. Okay? So arthrodesis means, well, I guess to be technical in terms of medical coding, it's the immobilization of a particular part or fusing together a particular part. Now, immobilization, whenever we're coding for the spine, also includes something else. The instrumentation. Yes, instrumentation is put in place to secure the graft or implant. All right. Often we have instrumentation, but whenever you have spine surgeries, you have to code. Whenever you're coding arthrodesis and instrumentation, you cannot code instrumentation separately. It always has to accompany arthrodesis. All right, coder, let's summarize. All right, let's review John's procedure. And also through this review, we're going to kind of help you understand how to code for spine procedures. First of all, you have to understand and know how the doctor approached the procedure. And we know that John was laying supine, so this was an anterior approach from the front. Next, we need to know how many discs were we coding for. We know that it was one disc. The next thing that we have to do is code for the actual discectomy. The discectomy is the removal of the disc. The next thing that we have to code for is the harvest of the bone graft. Next, we took the graft and performed arthrodesis. That's placing the bone graft in the area where the disc was. In fact, the bone graft is an implant. And finally, we have to code for the instrumentation. Okay, things are a little out of order, so I apologize for that. But all of the additional items outside of the discectomy require a modifier 51. So when you're coding these additional procedures, you're going to need a modifier 51, unless it's an add-on code. If it's an add-on code, no modifier 51. All right, I got to show you something. Here is what I'd like to show you. Most of John's procedures are the FTRs. So it's really, I'm glad I was able to provide that kind of visual for you visual learners. I am really thinking about you this go around. All right, first things first, what is the approach? And if you notice, I'm going to put a question mark. Whenever you see an FTR and it's got a question mark, that's something you have to answer. That's something you've got to know. Number 2, what are the number of discs and segments? 3, did arthrodesis take place? 4, was there instrumentation? If the answer is yes, then you code it, okay? 5, was there a harvesting of bone graft? 6, were there nerves involved? Sometimes there's nerve surgery or neurosurgery going on as well. 7, use modifier 51 for multi-procedures. Make sure you do that. And instrumentation must always be coded with arthrodesis, don't forget. And watch modifier 62. A lot of times these procedures have 2 surgeons, but they aren't co-surgeons. Co-surgeons means they're operating in the same capacity. So let's say so they have to be doing the same exact thing and they have to use the same exact code if they're doing the same exact thing, correct? So if one surgeon is harvesting bone graft, the other one is actually doing or performing the discectomy, then you know what? They're not co-surgeons. They're doing different procedures. My mother had a surgical team, but 2 of the doctors were indeed co-surgeons. In fact, when one physician, they were in there for a long period of time. I think they were in there maybe 8 or 9 hours. I'm not saying that the surgery may have taken 7 or 8 hours. I'm not sure, but it was a long, long time. And one doctor, would take a break. The other one would take over. And this kind of went on throughout the 9-hour period. So they indeed were co-surgeons. All right, coders. So these are your FTRs and GTRs, and we're going to talk about instrumentation. Just want you to kind of recognize the different types, and then we're ready to code.